Dear friends, as COVID cases are going up day by day, center and states have appealed to private practitioners, retired government and army doctors to come forward and join public healthcare system to serve COVID-19 patients. How in some cases it is not clear how much stipend the government is going to offer, while in some cases there is a huge difference between the salaries. Uh, to speak on this issue, we have Dr. Anant Bhan. Dr. Bhan is an adjunct professor and researcher in bioethics at Yenepoya University, Karnataka. Dr. Bhan, welcome to the show.
Thank you so much.
Dr. Bhan, what is your assessment of different kind of salaries and remuneration offered by different states?
Sure. So I think as you were mentioning, there has been a spate of recruitment recently once the COVID-19 infection numbers have been going up. In some cases, the recruitment has been as volunteers, so it is not really full-time recruitment as someone who's taken on as a salaried person. But this is asking for volunteers. So Niti Aayog, for example, asked for volunteer doctors, and they got upwards of around 31,000 is what was reported. And these were doctors who were either retired or those who were, who had left the armed forces after finishing their short service, etc. Or those from the private sector who wanted to volunteer. Similarly, I think there have been some requests for consultants to join. So, for example, in Mumbai, the Municipal Corporation of Greater Mumbai recruited, put out an ad for recruitment for doctors, etc. The specific ads which some of us have been discussing recently online are relevant to the field of epidemiology. As you've seen, epidemiology has become something which a lot of people are interested in because of the way that they crunch data and are able to look at trends. And not so surprisingly, because we know that is sometimes the case with the health system, there have been many vacancies for epidemiologists, both at the state level and also more at the local level. So I think certainly states have woken up to the fact that they never recruited epidemiologists, even when they were post lying vacant. And there has been a hurry to start advertising for those positions. Now, these ads have been coming up from many states and also at the local level from municipalities, etc. And we're starting to see that there is a variance in the kind of salaries that is offered. The Bangalore Municipal Corporation, for example, put out an ad recently where the salary that they have quoted is around 25,000 per month, and it's a short-term position. It's not actually a long-term position either. Some other states have done better. It's the salaries there, I think what I've seen are somewhere in the range of 50 to 60,000, which is closer to someone who would come in maybe at the equivalence of a research fellow or a GRF, etc. But obviously, if you want to get someone with experience, then that is going to be a fairly low amount, and it's hardly likely that individuals would join. So the other element, as I was also referring to in the Bangalore case, is that these are short-term employments. So it might be 3 months or slightly more. And so would individuals be willing to join, because obviously that's an offer you job security. So those are the two elements which are sort of coming up clearly, that one, this position is only being thought of as a short-term value position, and also it's not being given adequate salary levels to actually attract talent at the time when you most need it.
The 25,000 is definitely very less, for a metro city like Bangalore, where rentals are very high.
Yes, and also it's, I think, if you look at the kind of qualification they are looking for, usually with master's level education, with medical background, then that would be much, much lesser than what someone like that would probably earn just by working in a private hospital or working in another, even in a NGO for that matter. So would you be really able to get anyone? Doubtful. Maybe some people who are living in Bangalore and are looking for something short term to get experience, they would come in. But my concern also is, if you have only freshers joining, then by the time that they learn the ropes, because obviously your practical experience is different from what you learn in a medical college or in a public health school, then the COVID-19 situation might have already passed, or it might be on the way. So actually, when you need people to be on really on the game in terms of being able to respond, you might not be able to get that if you are recruiting at such a junior level, non-experienced individuals. So I think what is relevant is that you need to get people who bring in a mix of experience, and probably some of these individuals can be freshers, but at that salary point, it's extremely difficult to expect anyone with experience to join.
What is the ideal salary which should have been offered to the doctors, especially epidemiologists?
Yeah, well, I think, so there is, I don't think there is one magic number, but I think you have to recognize that these are individuals who've been trained as specialists. So they've gone through bachelor's level education, often in medicine, one of the medical, or allied branches, and then have a master's level education in public health training. So, the kind of salaries I would be thinking of, even for freshers, would somewhere be upwards of 50, 60, 70,000. And then those with more experience would be obviously valued at a higher amount. That would be probably something as a base amount, and then you factor in living costs. So, someone who's joining in, say, a Delhi, Mumbai, Bangalore, Pune, a metro city of anything of that size, would probably, the cost of living are much higher than someone who's working at a district level in a rural district, etc. So you would also need to factor in the cost of where you are recruiting someone for, and what would be the cost of, hiring a small apartment and daily transport and food, etc. So I think you have to factor in a mix of things and then be able to advertise, because then you will probably also make it attractive enough for individuals to consider joining. But the second element is important as well. People would be reluctant to join for a short 3-month period. If I was someone, for example, who was interested in working in epidemiology, if I knew that I was being asked to join in only for 3 months in a city which is far away from where I live, then I might be reluctant to go, just because it's not, by the time I settle in, I will then again have to start looking for a job. We know that this is not going to be the last health problem that we have. Probably we'll have we always have on anyway a lot of communicable and non-communicable disease. We have a need to keep collecting data, analyzing it, looking at disease trends. So, I mean, in any case, epidemiologists should be long-term investments of the health system. So these should be permanent positions, ideally. And then you should be advertising also at good salary levels, so that you get individuals who are interested, who are committed, and who will stay on and strengthen the health.
Dr. Bhan, central government has also invited doctors through Niti Aayog website, and we came to know that around 30,000 people have applied for the work. So do you have an idea how much stipend the central government is offering to them?
So the Niti Aayog advertisement just said volunteers. So I don't think they've specified anything as a stipend. I'm not even sure that they've started deploying anyone. It's just that they've probably made a database of individuals who might be willing to serve if there is a worst case scenario. Many states are hiring for specialists to join in helping to run the COVID-19 specific hospitals which have been started. And there also there is a salary range. The highest I've seen is actually around 3.5 lakhs per month, 3.5 lakhs per month, which is being offered by the Bombay Municipal Corporation for one of its COVID-19 hospitals, the Seven Hills Hospital in Andheri. But it seems to be the case again there that there is a shortage of personnel within the health system who can even run clinically some of these hospitals, and hence they have to advertise for those positions. And some of those ads are also coming from the district level. But the central government one, the one from Niti Aayog, didn't specify a salary. It just had volunteers, so it might be just pro bono work for all.
Mm-hmm. Okay, so what is your advice to the government?
I think it's fine to expect someone to volunteer to help out, and I'm sure many professionals would be willing to do it as part of their feeling that they want to contribute, especially at a time when there is a national crisis. But that is only a temporary solution. I think what we need really are long-term solutions, so that we have a resilient, strong health system which is able to respond to these kinds of needs when crisis situations arise. And the way to get there is actually to have enough human resources. A lot of times we have, for example, infrastructure brought in, but not enough human resources. Sometimes we have human resources brought in, but they are not adequate, or they're not trained correctly, or you don't recruit the right kind of individuals. To make sure that you actually have an excellent health system, you need a combination of things. And one of which is to ensure that you have enough people of the right kind, of the right training, and that you probably recruit them in advance of a crisis like this, so that they are already a part of the health system and can respond. I think there is a lot to learn from our experience in COVID-19, and hopefully that will mean that health systems at various levels will ensure that they have enough staffing available so that they are not left scrambling to get staff at times like this, so that they are already the human resources are already in place, and then they can hit the ground running when there is a situation like this and they're able to respond. At times like this, it will be difficult to find enough people because there are not so many people out there who are trained in epidemiology. At the back end, that also means that we should be encouraging more training programs in epidemiology. But again, training programs will only work when people have jobs once they graduate. So it has to be corresponding, being also linked to ensuring that there are jobs available so that individuals who pass out from these institutions are then absorbed into the health system and have jobs to do. That applies to any specialty within public health or medicine or paramedical science.
Thank you, Dr. Bhan, for talking with us. Thank you.
Thank you so much. Pleasure speaking to you. Take care. Stay safe.